Hello and welcome to the Health Research Podcast, where today we're recording from the Health Research Board's conference here in Dublin. The theme for this year's event is Advancing Evidence-Informed Policy for Health and Social Care in Ireland. I'm your host, Danielle Barron, and in this series we explore how research and evidence can shape better policies to help service users, communities and society at large. In our mobile studio today, we have Professor John Lavis from the Department of Health Evidence and Impact at McMaster University in Hamilton, Canada, and Dr. Fergal Lynch, a former Secretary-General of the Department of Children and a former Deputy Secretary-General at the Department of Health here in Ireland. We also have with us Dr. Barbara Whelan, who is Acting Programme Manager and Research Fellow at Evidence Synthesis Ireland and Cochrane Ireland, based at the University of Galway. You're all very welcome and thanks for joining us today. So we'll start the conversation today with Barbara, because in this episode we're looking at how effectively our health policy making system sources, produces and uses research evidence. And we're zoning in on a crucial piece of work which Barbara led on and was presented for the first time today at the conference. It's called a Rapid Evidence Support System Assessment, otherwise known as a RESSA. I really like that acronym. And it has taken a thorough look at the capabilities in Ireland's evidence-informed policy-making ecosystem, looking at issues such as connectedness to global evidence networks, rapid evidence synthesis capability, and preparedness for other challenges, such as another pandemic or climate change. So Barbara, maybe you can just begin by giving us an outline of what was found in the RESSA.
Yeah, so the RESSA is looking at three different parts of the evidence support system. So that's the demand side, so it's the evidence users and the evidence that they need, the supply side, the evidence producers, and then the interfaces, the connection between those two things. So we looked at what's working well and where there's room for improvement within those three different parts of the evidence support system. So what's working well? We found there is a commitment to using evidence to help make policy decisions. The department has built a strong analytical and research division, and data capacity has expanded. There is production of a wide range of good quality evidence across the system, with national agencies such as HICWA, the HRB, the ESRI being trusted analysts and providing evidence products. And there's structured collaboration between policy teams and researchers in some areas, such as the HRB's Evidence for Policy programme. So they were real positives that we found. Where there's room for improvement, we found that confidence, skills and resources for sourcing, interpreting and applying evidence vary. There's no formal process for prioritising or tracking evidence needs. And modelling, evaluation and specialist analytics exist, but are spread across different teams and often mobilised ad hoc, making turnaround difficult for emerging policy issues. Commissioned research and evidence outputs are not held in a searchable central place. So this is important that people can see what was requested previously. Possibly they can use the evidence that was available from that time. There's no consistent approach for assessing evidence quality, tracking its influence or learning what worked. And finally, we found that informal relationships are important across the system, but they also are vulnerable to staff changes. So that's something that we found just to note. It's important to maybe have process involved in those relationships.
Okay. So that seems to me a bit of a mixed bag in terms of the findings. And we'll delve more into those findings as we go. But John, I know that there's an international context to the RESSA, and I'd love you to explain that to us briefly, the original background and the purpose of RESSAs.
Sure, absolutely. So I think coming out of the COVID-19 pandemic, there was a real sense in the evidence community and in the policy community that some aspects of how we mobilized evidence to inform decision-making during that time went really well. And there was a lot of incredible innovation that happened. Ultra-rapid forms of evidence production, these new living evidence syntheses that get updated as the context evolve, issues evolve, evidence evolve. But there are also things that didn't go well. Heartbreaking amounts of duplication. Every country, Ireland, Canada, looking at the same evidence and so on. So 12 countries came together and said, surely we can learn from each other. What's going well? Where could we each be thinking about doing better together? Ireland came to the table from the beginning alongside Canada, these 10 other countries. We developed this process for these rapid evidence support system assessments, and then each country then implemented them in a way that was appropriate to them. In Canada, we moved really fast. We felt there was a window of opportunity. We did more of a learning and improvement approach. Brazil did an incredibly comprehensive approach all across government, all levels of decision-making. Ireland watched and waited for a little while and then did, without question, the most rigorous one, published the protocol, exemplary approach, incredibly well executed, well analyzed. And today we finally saw the fruits of all of that labor.
Okay, great. We've heard on previous episodes of the Health Research podcast that there's room for improvement in the production of evidence and its use by policymakers. And I think it's fair from what you said, Barbara, Ireland is doing pretty okay, but there's lots of areas where it could do better. So Fergal, I want to come to you because, before we talk about rapid evidence synthesis, it seems we need to have a conversation about the broader evidence for policy culture in Ireland. And you've had a bird's eye view of this over your career, and you'll have seen what has improved, I suppose, in that time and what still has to improve. So what are your thoughts on that?
Well, I think we've come a long way. I come from a time when evidence, data, research was almost an add-on, an optional extra. And we've come a considerable distance since that time. When I worked in the Department of Health in the 90s, I was involved in the development of the first national cancer strategy. And it may seem strange to think, but at that time, the data that individual hospitals had, for example, about their own outputs and their own outcomes, would be examined to a very minimal extent, even by the hospitals themselves, let alone by the system as a whole. Mm-hmm. And yet within 5-10 years of that, we were realising just the sheer benefit of looking at that information, harnessing it and making good decisions on foot of it. So, for example, we ended up making major decisions in the development of our cancer services by concentrating services in a smaller number of larger locations on the basis of the data that we had. It seems strange in today's world to think that, we'd even comment on that now. But at that stage, it wasn't the norm.
That was huge.
We've come a significant time since then. We've more to do. What I like about the current situation is, and even listening to the conference this morning, the culture, the sense of interest, the sense of resilience, the sense of determination is it's definitely there. Now we need to harness it and pull it together in a particular way. And we're having a discussion about that. But I'm very optimistic for the future.
Okay, great. Barbara, I know that interviews were conducted as part of the RESSA. Did issues like that come up in terms of that culture and that evidence for policy culture in Ireland?
Yeah, absolutely. So, the people I interviewed, one person described it as the bedrock of what they do, so it needs to be evidence informed. And it's also, that idea of spending public money, that you need to have evidence behind it as to why you're doing and making a decision to do something or doing a particular thing or making a particular policy. So definitely what you're after speaking to Fergal there is what came up in the interviews. Yeah.
So John, there obviously seems to be a behavioural structural aspect to this. Just touching on the behavioural for a moment, for policymakers to have the confidence to act on evidence, they need assurance that they're doing the right thing in accordance with their own professional standards. And the RESSA referred to a need for quality assurance and transparency. So apart from things like health technology assessments and clinical guidelines, they're obviously a given. What minimum standards should every evidence product meet?
Yeah, it's a great question. I guess we produce, our group and many of our peers produce many types of evidence products, but they're usually built up from different forms of evidence. So we may be asked the question, how big is this problem? Is it getting worse over time? What do we think the drivers of it are? So we may look at data analytics, we may look at modeling studies, we may look at qualitative studies. Each of those, and I'll come back to maybe later in the conversation modeling, each of those has its own approach to assessing quality. So a group like ours finds the studies, assesses them, and then presents them to the decision makers saying, here's what we know, and here's how much confidence you can place in it, any caveats that would be associated with it. Same thing when you come to thinking about policy or program options. You want to know about benefits, harms, and costs. Things may have been evaluated with a randomized trial or an interrupted time series. We can assess the quality of those and again, give the decision maker a sense of how much confidence they can have in it. So each form of evidence has its own mechanisms that you can use to assess quality. And what groups like us do that pull many of them together is do that for each form and then say, here's what we've learned. And again, how much confidence you can place in it, what caveats should be there.
Okay, that makes sense. Fergal, coming from the policymaker angle, what are your thoughts on that then, those minimum standards that would ensure quality?
I completely agree with what John is saying. It's absolutely vital that you do it in that way. And underlying everything, I think, has to be transparency. The policymaker has got to be satisfied that what you have done makes sense, that it's rigorous, that it has adhered to certain standards. He or she doesn't need to get into the technical elements of that, but they need to be reassured that those standards have been adhered to, that this has been done rigorously and properly. I think then it's very important as well, when you're doing something like this, that you then present the review very, very clearly in an accessible way for policymakers. The temptation, understandably, particularly for researchers, is to locate the results within a context more of the technical elements of the research. Mm-hmm. What you want for a policymaker is, what does this mean to me? It's almost the elevator pitch. What are the 3 or 4 key messages? And for me, the sort of minimum standards required in that are, have we communicated properly? Can we quickly access what this piece of research is saying to us?
Okay, communication really is essential there, isn't
vital,
it?
Yeah.
So Barbara, I'll come back to you because I want to get to the R in RESSA, the rapid evidence synthesis from a structural point of view. So the RESSA identified several enablers for a more prepared and effective system. So what about the need it identified for a centralised open repository? Because you talked about that access to the research and evidence. What would that look like, and how practically could it work?
Yeah, so the idea there is that you'd have all commissioned research and possibly evidence requests as well in a centralised repository, so that an evidence user, a policymaker, could go and see what's been commissioned previously, what was the evidence that was found, and possibly as well how that evidence influenced a policy or not. So there's a real kind of thread through there to see what's been done before, because again, it's about reducing duplication. So being able to see, you might have a question that needs to be answered and possibly somebody had a similar question 2 years ago, and to see what evidence was produced through that.
Okay, because John, you used the word heartbreaking duplication, which, researchers know all about heartbreak. But the RESSA actually refers to a coordinating node for rapid evidence synthesis. So how practically could that operate?
Yeah, well, we run a number of these types of mechanisms for Canadian federal government departments, provincial and territorial governments, and we have counterparts in other countries that do it. They all look somewhat similar. It's a mechanism that policymakers know they can go to when they have a question. They tell you what the time constraints are. We have 2 business days. Our question is primarily about problem and drivers, or what we know about different solutions. That group then hears that question, realizes I need these 3 forms of evidence, and then they'll try to pull them together from existing research. So if it's a 1, 2, 3 day timeline, it's what's already out there. If you're in Ireland, it could be 7 local studies, but it could be 2 evidence syntheses. What have we learned from around the globe that could be applicable to the Irish context? If you have something more like 2 to 6 weeks, then you could do rapid primary research and go out in the field and very quickly do a new qualitative study or a new piece of rapid data analytics. So this hub is a place where the policymakers knows they can go to, and someone can interpret the question into the types of evidence that are needed, and then package it back up and re-inject it into the policy process alongside all the other political considerations that inevitably will be in play.
Fergal, if we had such a thing as a coordination node, would that change commissioning behaviour, do you think?
I think it would inject more and more confidence in the system. There's no doubt about that. I think we're actually crying out for this coordinating approach to replace what is often an individualised approach, good and all as many of the individual components are, or the initiatives are. To have that coordinated approach would make a significant difference. I think the ingredients are there, the enthusiasm is there, but to have easy access to the information would be of significant benefit. It means when you know it's coming from a trusted, experienced source, then it's valuable. And indeed, Barbara's work earlier that she mentioned in relation to the RESSA, particularly the procurement model that she was proposing, I think would be very, very valuable in that regard.
So the RESSA also refer to modelling. Barbara, if you could kick this off, maybe John, then you could come in. Where does Ireland need that modelling capacity? I assume it's crucial.
Yeah, so modelling capacity, it's not so much the modelling capacity issue, it's more about the coordination and access to that. So, there's lots of different modelling going on, but the groups are in universities or in external agencies. So it's really to have, a coordinating node for all of that expertise in one place so that it can be tapped into, essentially.
And John, can you give me more the international context in that, maybe the system-wide need or the economic need even?
Yeah. Well, I think modeling is an absolutely critical form of evidence that needs to come into play. With the Global Evidence Commission, we talked about these 8 forms of evidence, and they each serve their unique needs. The thing that's a bit different for us when it comes to modeling is there's no agreed standards that you can use to assess the quality of a modeling study. So when we're asked to include modeling studies in our rapid evidence products, we never know quite what to do with the modeling studies. We'll say, here are the data analytics studies, here's their quality, here are the evaluations, here's their quality. But with the modeling ones, we're kind of left saying, there's 3, but we can't really determine which might be the best one for you. And when you call up individual modelers, they all prefer their own model or a model using the same method as they're used to, but that doesn't give you that objective assessment. So I would love to see modeling be like the other domains, has a set of quality criteria. So folks like us that are asked by policymakers, can we have confidence in this? We would have some objective criteria we could use to assess it.
So to make it a bit more standardized.
Yes.
Okay.
Yeah.
So this is going to bring us to the critical question in all of this, which I hope you'll all have something to say about. That old saying goes, act in haste, repent at leisure. But this is too serious a matter for us to afford that leisure. So how can we balance speed versus quality? What safeguards are needed? Fergal, I might come to you on that.
I think the critical first step is to be confident enough to start slowly. Don't rush. If you try and launch into everything at once, you'll achieve very little. So start slowly, pick the right proposals at the right areas that you can build trust on over time. And then as you build that confidence, you can do more. I think it's an absolutely crucial balance to achieve between speed and quality. And if you do it too fast, or particularly if you do something that is quickly discredited or brought into question afterwards, that raises a major question. So start slowly, pick your right proposals, work your way through those, and then as the information grows and as the evidence of you being able to do it properly grows, you'll build trust and confidence to do more.
Okay, Barbara, did that come up in the rest? So what kind of safeguards are needed?
Yeah, so I think transparency comes across. I think Fergal mentioned transparency earlier, and definitely in rapid evidence, transparency in methods is really important. And we've also mentioned quality, so minimum quality standards, and also the idea, I suppose, of in rapid evidence to track what rapid evidence is being produced and then how it's been used so that we can understand, I suppose, more, because I think the rapid evidence use in Ireland is happening, but it's happening slowly. So it's to understand now how it's used, if at all, to inform decisions. So to make sure that we're, I suppose, producing the right product for the demand.
And John, what would you have to say on that?
Well, in a way, I can answer it at 2 levels. One, any individual request that comes in, if you tell me we need the best you can do in 2 days, we'll deliver for you. But we'll also say, here are the things we could do and here are the things we couldn't do. So we may have found all the studies that we think would be relevant, but we may not have been able to quality assess them all. So we think, to your point, Barbara, transparency is absolutely key. And then you can keep making it better over time. Having delivered that product in 2 days, you say, actually, now we're so intrigued, we'll give you another 10 to add some of the other bells and whistles that will give you more confidence, then we'll do that. So transparency, absolutely key. I can also maybe answer it at the system level, which I think in part was what Fergal was getting at, that we need to Ireland's already doing a lot of this stuff really well. So how do you make incremental improvements, learn as we go, and keep getting better over time with the system as a whole? So many pieces of this system are firing on all cylinders. What would be the next logical steps that would have the biggest impact on all of us if they were to be put in place? And let's learn and improve over time.
If we were all to reconvene here in 3 years' time, what indicators would tell us that Ireland has built that fit-for-purpose rapid evidence synthesis system? Like the RESSA has clearly outlined where we need to, where we need to go with this. So how would we know? How would we know that's where we should be?
Yeah, so I often think of one interview I did with a policymaker, and she described, being faced with a new policy question, and it was like, what are my data sources? Where do I go for evidence? And she likened it to a rabbit caught in the headlights. So for me, if I think in 3 years' time, if the RESSA has, if we have done good work in developing a good evidence support system, a policymaker like that is faced with a new question, but there's a pathway that they know, okay, either I can go to a knowledge broker to, assist with, maybe developing the question and the evidence that's needed, or there's different groups producing different forms of evidence, and it's an obvious route as to how to get that. So that's, for me, is one of the things that comes to my mind, to think in 3 years' time how we could have improved the system.
Okay, and Fergal, would you agree with that?
Totally.
Yeah.
And for me, I would say a big indicator would be the actual extent of usage of this approach by government departments. And dare I say, even the knowledge and understanding of the term RESSA, which people are getting used to at the moment. It was fantastic to see a minister very much on top of and interested in during the conference there. You'd like to feel that other ministers and other officials will be equally on top of and interested in that. And finally, I'd say in terms of the ecosystem, the structure that we're looking for, the coordinated structure, under which you'd move from many of the sort of informal contacts and word of mouth and good individual personalised relationships, more to a structured engagement. If we can get to that stage, that would be very positive and very powerful.
Okay, and John, I know Canada are doing great on this, so you're the person to ask. Where should we be in 3 years' time?
Well, I would say the same in Canada, where I think we still have a lot of learning and improving to do. I would say what I would love is the top public servants in every department would say confidently, I can get the evidence I need when I need it. And that would be, I think, an absolute breakthrough. To Barbara's point, I think right now there's kind of a sense, we'll kind of figure it out. We'll call our trusted contacts. We'll kind of figure out what we can do. But what I'd love to see is that confidence that they can get it when they need it. And what that looks like in health may be different than in a space like climate and the environment. With health, it may be they push a button via the Health Research Board. Climate and environment may have a variety of different mechanisms, but each of those secretary generals and the people who report up to them need to know that confidence. They can get the evidence they need when they need it.
So, John, is there anything happening globally that you could tell us about that could maybe help Ireland with this?
I think, the most exciting thing in my space, I've been trying to support government policymakers for 3 decades, but the big breakthrough that started in this last year has been the emergence of something called the Evidence Synthesis Infrastructure Collaborative. Because so often what policymakers want to know is, what can we learn from other countries that may face similar contexts and be dealing with similar issues? But historically, that's meant Barbara, folks like me, others had to go away and find all of those studies, assess their quality, pull it all together. What ESSEC's trying to do is bring artificial intelligence, where it can be done safely and responsible, into the synthesis process. So in future, when a question comes into me, I don't have to find every study, assess each of their quality. That will have been done through a much more efficient global mechanism. I'll pull down that data and then say which of these studies are relevant to Ireland, and then I'll put that into the mix. So you're always going to need to have each of those Irish studies, but this will be a way to learn from other countries in a much more efficient way. So we really think it's going to transform how that global dimension of the support to policymakers happens.
Yeah, so it really seems to come down to coordination, not just within Ireland, but also internationally.
100%.
So, Barbara, are we making those efforts on international coordination?
Yeah, absolutely. So, in Ireland, Evidence Synthesis Ireland and Cochrane Ireland are linking in with ESSEC and keeping abreast of all the developments in that. And I think then the key will be that idea to pull that information from the global infrastructure as such, but then to contextualise it to your local situation. And I think that's where possibly there's kind of an expertise, there's a gap there at the moment of having people who can do that. So I suppose having that knowledge, I've been able to pull it, as I say, from the global infrastructure and then to make it, what does this mean for Ireland, for example? Or in
and to recontextualise it for us, obviously.
Exactly.
Can I come in there? Because you make a very valuable point there, Barbara, which reminds me of just from a perspective of a policymaker, and particularly the older style policymaker who would have very much said Ireland is different. We're completely different from the rest of the world. Everything happens differently. So there's no point in looking at international material, which of course is simply not the case. But I think the sort of information that we're getting from RESSA and similar style projects helps us understand that Ireland, while different in many respects, is demonstrably very, very similar, faces very similar types of issues as any other country in the world. It should also build, therefore, our confidence in looking much further afield than we currently do. And the existence of something of what John is describing will be hugely helpful in that regard. It gives us the confidence and ensures that we look much more further afield than we used to.
Okay, so that's it for this episode of the Health Research Podcast. You can listen to all episodes on major podcast platforms and on video on the Health Research Board YouTube channel. Links to audio and video versions are also available on our website at hrb.ie. And all that remains for me to do is thank my guests, Professor John Lavis, Dr. Fergal Lynch and Dr. Barbara Whelan, and of course to thank you for tuning in.
This podcast is a production of the Health Research Board, Ireland's state agency for conducting and funding health and social care research.